Do hair growth serums really work? Rogaine, serums with rosemary in it. I'm Dr. Anita Lunga, and I'm gonna clear up the mysteries about hair loss serums. The number one treatment that most physicians and dermatologists, who are physicians that specialize in taking care of the skin and the hair, recommend is Rogaine. Rogaine, which is also known as minoxidil, has a very interesting history. It was actually initially a blood pressure medication, and we noticed as we're giving our patients this blood pressure medication, they started to say, hey, I'm growing hair all over my body. So they took this medication, repurposed it into something topical that you can put on your hair, and some men actually use it to make their beard thicker, but you put it on your head and it can help your hair grow over time. Now, Rogaine, at least in the US and Canada, is over the counter. So if you figured out that, hey, I had the flu last month and suddenly my hair is thinner and I feel fine, I don't think I need to, go talk to my doctor about hair loss, and you want to try something over the counter that will work, Rogaine will work. And I'd recommend getting the men's version. For some reason, the women's version is weaker and a little bit more expensive. For women, you can get the men's version as well. Put it on your scalp, primarily in the areas where your hair is thinning, and you have to use it consistently for at least 6 months before you start to see positive results, meaning your hair will start to grow out and the top section will be a little bit thicker than the bottom section, and eventually the rest of your hair will grow out thicker and to the same length as to match the rest of your hair. So results vary by consistency. If you don't use this medication regularly, you use it once a week, you may not see positive results. And if you use the medication, say for 1 year, and you stop using it, the positive results you may have seen may disappear. But if you're using it just for a short period of time, you just want your hair to grow back fairly quickly, say your hair is already pretty short and you just want it to thicken back up and you think you'll be fine, you can think about stopping or discontinuing the medication, but likely the results that you have for that short period of time will go away. In contrast, some of the other serums may have positive properties. A lot of people are talking about using serums with rosemary in it. The studies are mixed. I would say that, if you're serious about getting something that's over the counter, you should perhaps try Rogaine. Rosemary serums or rosemary oils may vary in their strength and you might not get the results that you want. If you have already tried that and you're not getting positive results, again, you should probably talk to your doctor to find out if there's another more serious reason that could be causing your hair loss, and or to talk about other medications. I'll give you an example. Finasteride, which is used off-label for men, or spironolactone, which is also used off-label for women, depending on whether they have another medical condition that could be causing their hair loss. You can talk to your doctor about whether you qualify for these medications to help manage your hair loss. Bye-bye for now.